I have had Botox twice now, this time with no result. Do you think I could be finally resistant to Botox? I have had Botox regularly, 3, 6, 9 months, for 11 years. My lines used to go flat. Now there is just no effect. I don't think I overused it. If I didn't need it, I wouldn't get it. I went back and got an additional 5 units when it didn't work, but there was no effect.
Thank you for your question. You state in your question that you've been getting Botox for 11 years and you were used to or accustomed to seeing lines going flat. And recently you went to get Botox and you feel like you had no effect. You got additional 5 units and you still have no effect. So you're asking, are you in some way immune to the effects of Botox? Well, I can certainly help you with this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculoplastic, oculofacial plastic reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. As an aside, it's important to note that oculoplastic surgeons were amongst the first doctors to use Botox along with neurologists, because before there was the cosmetic indication, there was the original medical indication, and we were treating patients with various spasms like benign essential blepharospasm. So it's certainly a reasonable question you're asking. What I try to do to help patients understand whether or not the Botox is working is first to distinguish the presence or absence of a line is one indicator, but the more important indicator is the activity of the muscle that is intended to be treated. And the only way to test that is by activating that muscle. So if you injected the crow's feet lines without scrunching your face or without pushing the cheeks upward, just squint your eyes, and if the muscles continue to contract, well, then it's either the injection was not effective, the dosage may not have been high enough, or you have some type of resistance. And the same thing can be applied for anywhere else. First, see if the muscle, if you can frown, like if you can move that muscle, and then in that case the same applies. Now what happens, of course, with time is the collagen and soft tissue in the areas of concern can also diminish, which means that lines that formerly were flattened, as you described, may need additional modalities to help improve the depth of those lines. It's not uncommon to need a combination of Botox and a filler, or a Botox, a filler, and platelet-rich plasma. The idea is that when we are losing volume, if you think of facial aging, of loss of bone, muscle, fat, soft tissue, it's important to understand that. But to make that distinction, make sure that you can differentiate between muscle activity and the absence of muscle activity. Now, that being said, it is possible to have antibodies to the botulinum toxin. In my own practice and personal experience, when I found that patients would demonstrate something like this, and it is relatively rare, even with a large volume of patients who we treat, it is possible to try another drug such as Dysport or Xeomin and see how they respond to that. So you're not completely lost or left without some kind of treatment, but you can certainly try these other drugs which structurally differ from botulinum toxin that's found in Botox. So I think you need to discuss these details with your doctor and understand and figure out to differentiate lack of the causes of your lack of satisfaction from the results of the most recent Botox treatment. So I hope that was helpful. I wish you the best of luck, and thank you for your question.